Thank you for subscribing to this channel. This is a Reading Part C practice video.
The correct answer is C. Inform patients of the changes to be implemented. Let's explain why this is the correct answer and why the other options are incorrect. C. Inform patients of the changes to be implemented. This is the correct answer because the email clearly states that the admin team is asking frontline staff to inform patients of the changes that will be implemented over the next 6 months. The email mentions that patients should be made aware of these changes at the end of each appointment, indicating the need to communicate the new policy to patients. A. Charge a fee to patients who cancel their appointments 3 times. While the email does mention that patients with more than 3 cancellations will be issued a $25 fee, this option focuses on the action to charge the fee, which is not the primary request made in the email. The main request is to inform patients of the upcoming changes, not just to implement the fee. B. Call patients with a reminder 24 hours prior to their appointment. While the email mentions that office staff will call patients at least 48 hours before their appointment to remind them, this is a specific task related to appointment reminders and not the primary request made in the email. The main request is to inform patients of the upcoming policy changes over the next 6 months. In summary, the primary action requested in the email from the admin team to frontline staff over the next 6 months is to inform patients about the changes that will be implemented. Option C accurately reflects this request.
Let's look at the next question.
The correct answer is B, to prolong the effects. Let's explain why option B is the correct choice and why the other options are incorrect. B, to prolong the effects. Epinephrine is added to lidocaine injections primarily to prolong the effects of the local anesthesia. Epinephrine works by constricting blood vessels at the injection site, which reduces blood flow to the area. This constriction slows the absorption of lidocaine into the bloodstream, allowing the anesthesia to remain effective for a longer duration. It is a vasoconstrictor that helps in keeping the lidocaine localized to the target area, thus prolonging its effectiveness. This can be especially useful during minor medical procedures to maintain adequate anesthesia for a longer period. Now, let's discuss why the other options are incorrect. A, to numb the area. While the addition of epinephrine does contribute to the numbing effect of lidocaine by preventing pain signals from traveling along nerve fibers, its primary purpose is not to numb the area but rather to prolong the duration of the anesthesia. Numbing is a result of the local anesthesia, and epinephrine assists in maintaining that numbness. C, to reduce patient discomfort. While it's true that adding epinephrine can reduce patient discomfort during the injection by maintaining the effectiveness of the anesthesia for a longer time, the primary purpose of epinephrine in lidocaine injections is to prolong the duration of the anesthesia. Reducing discomfort is a secondary benefit of this action. In summary, the main reason for adding epinephrine to lidocaine injections is to extend the duration of the anesthesia, making option B the correct choice.
Let's look at the next question.
The correct answer is B. Collect information about patients from their friends and relatives. Let's explain why this is the correct answer and why the other options are incorrect. B. Collect information about patients from their friends and relatives. This is the correct answer because the policy document clearly outlines the importance of gathering collateral information from friends and relatives of psychiatric patients in the emergency department. It emphasizes the need to contact those who might know the patient best or were in the patient's company prior to their arrival at the hospital. The policy provides guidance on how to approach this process, including obtaining contact information and ensuring the confidentiality of the patient's information. Now, let's discuss why the other options are incorrect. A. Gather information from colleagues about specific patients. The policy document does not address the gathering of information from colleagues about patients. It primarily focuses on the collection of collateral information from friends and relatives. While colleagues may have some information about specific patients, it is not the main subject of this policy. C. Inform patients and their carers about recent diagnoses over the phone. The policy document does not provide guidance on informing patients and their carers about recent diagnoses over the phone. Its primary focus is on the importance of collecting collateral information from friends and relatives of psychiatric patients for appropriate disposition in the emergency department. In summary, option B is the correct answer because it aligns with the content and purpose of the policy document, which is to guide staff on how to collect information about patients from their friends and relatives in the context of psychiatric care in the emergency department.
Let's look at the next question.
The correct answer is C. Identify the cause through physical examination and tests. Let's explain why this is the correct answer and why the other options are incorrect. C. Identify the cause through physical examination and tests. This is the correct answer because it aligns with the content provided in the passage. The passage discusses the assessment and management of peripheral arterial disease, PAD, and emphasizes the importance of performing various examinations and tests to identify the cause and diagnose PAD. These assessments include asking about symptoms like intermittent claudication, examining the lower limbs for evidence of critical limb ischemia, checking pulses in the lower limbs, and measuring the ankle brachial pressure index. Additionally, the passage mentions the use of imaging techniques such as duplex ultrasound and contrast-enhanced magnetic resonance angiography for diagnosis. Therefore, the primary approach described is to identify the cause through physical examination and tests. Now, let's discuss why the other options are incorrect. A look for signs of swelling in the upper body. This option is incorrect because the passage specifically focuses on assessing and examining the lower limbs for symptoms and signs of peripheral arterial disease, PAD. There is no mention of looking for signs of swelling in the upper body as a primary diagnostic approach for PAD. B. Confirm that the patient has a history of poor diet. This option is incorrect because the passage does not emphasize checking the patient's diet history as a primary method for diagnosing peripheral arterial disease, PAD. While lifestyle changes, including dietary improvements, are mentioned as part of the treatment, the primary focus of the passage is on physical examinations, tests, and imaging techniques for diagnosing PAD. In summary, option C is the correct answer because it aligns with the diagnostic approach described in the passage for patients with symptoms of peripheral arterial disease, which involves physical examination and tests to identify the cause.